In the event that someone actually unfortunately have the diagnosis of prostate cancer, and fortunate enough to be 1/3 of the general populations in Malaysia that presented with prostate cancer that is organ confined, then we really need to work out something that can cure the prostate cancer. Curing prostate cancer itself can be done most radically with radical prostatectomy. Prior to the procedure itself, we will do a CT scan and bone scan to make sure that the cancer is confined in the organ and making sure that the surgery itself will remove the prostate. The removal of the prostate itself can be done several ways. Traditional way, which is an open operation to remove it, is often considered very cumbersome, has complications, and also has prolonged recovery period. So the inventions of robotic radical prostatectomy actually have several arms, has access to the deep part of the pelvis, and also have minimally invasiveness that will improve the recovery period. And it's also believed that men who undergo radical prostatectomy with the assistance of robot, they have less chance of erectile dysfunction and also less chance of getting incontinence of urine. All sounds very good. Yes, of course it's good if it's discovered early. However, there are certain things even the robot can't help. For example, the prostate itself is an organ for ejaculations. So once a prostate is removed from the body, then the chances of ejaculation is zero. Of course, if you're still contemplating having children, we can directly access to the testicle and get some sperms and create test tube baby. Otherwise, a man who has no prostate will have no ejaculation at all. There are many studies that has been used in order to to improve the erectile function after the operation, and that whole strategy is called penile rehabilitations. How is it done? Essentially, if you think about a medication that will enhance the blood flow to the pelvis, actually will make sure that the vessels itself are big enough, even with the insult, the operation will sustain that perfusion to the penis. And rehabilitation itself also carry on after the surgery itself. So hopefully the reductions of that injury actually will improve on erectile function. There are quite a wide range of complications quoted by various centers to highlight the risk of erectile dysfunction. That can range from 100% erectile dysfunction to about 10 to 20% having erectile dysfunction. Clearly, if the surgeon's experience is important, the mode of treatment is also important, and the overall health of the patient is crucial. For next week, many men say radical prostatectomy seems a bit too radical. Is there any other way of treating prostate cancer with less invasiveness? If you are interested, stay tuned for next week's Putting Dr. G on the Spot.